Hi guys, we are starting our lower back and hip flow, so you won't need any equipment today, just come and lie on your backs. Okay, so start with your feet hip distance apart, and we're just going to work on our connection first of all. So we're just going to be thinking about where we're feeling connected. So we should be feeling it underneath both our feet, underneath the lumbosacral junction, underneath the TL junction, both shoulder blades and the back of the head. So you're going to start at your feet, and we're just going to start to shift the weight from side to side until you can feel like your weight is a bit more balanced between the right and left foot. And then you're going to think about where you're feeling that connection underneath the foot. So are you feeling it on the outside or the inside of the foot? So if you're feeling it on the outside, I want you to try and bring that inner arch down towards the floor by pushing the big toe into the floor. Keeping the knees pointed to the ceiling, ankles neutral. If you can feel it more on the inside of your foot, I want you to bring the outer edge down towards the floor, but keep the big toe pressing down into the floor and keep your knees pointing towards the ceiling. Next, you're going to move up to your lumbosacral junction, so the junction between your lower back and pelvis, and we're just going to start to peel the spine away from the floor, taking the pelvis into an anterior tilt. And then you're going to reverse peel the spine, taking the pelvis into a posterior tilt. And we're just going to move the pelvis backwards and forwards, lifting the spine away from the floor and lowering it towards the floor. And then you're just going to pause in the midpoint between the two end ranges. Lower back should feel flat on the floor, there should be no gap, but you shouldn't be caved into the floor. And your lumbosacral junction should be feeling connected. So move your way up to your TL junction, so the junction between your upper back and lower back. And we're going to think of the ribs and pelvis like the pages of a book. So we want to make sure that the pages are closed. So ribs and pelvis are going to be in connection with each other. So bringing the ribs and pelvis into connection. What we don't want are for the ribs and pelvis to be disconnected, so that open book appearance. With the open book appearance, you'll have rib flaring and lumbar extension. So we're going to try and bring the ribs and pelvis into connection so they're parallel with each other, and your TL junction should feel nice and connected. Then you're going to move up to your shoulder blades, so they want to be equal from side to side. So just shift your weight from side to side until you can feel that you've got that connection equally between the right and left shoulder. And the shoulders themselves, they want to be neutral. So what you don't want is to be elevated and forward. So we're going to pull the shoulders down towards the back pocket, externally rotating the shoulders, so activating the muscles around the back and underneath the shoulder. And then try and bring them slightly backwards towards the floor. We don't want to pull them right into the floor. We don't want to pin them together. Just slightly backwards so that they're in a more neutral position. Then the back of the head is going to push straight down towards the floor. What we don't want is for the neck to extend, and we don't want it to come forward, so we're pushing the head straight down towards the floor, feeling those front neck muscles come alive, eyes pointed towards the ceiling. Okay, so once we've done that, we're going to make sure we've got our breath in the right order. So take your hand to the chest and one hand to your tummy. So we're just going to work on getting the breath in the right order first of all. So as we breathe in, the hand on the tummy is going to lift. And as we breathe out, the hand on the tummy is going to lower. The hand on the chest doesn't want to move anywhere. So just focus on what's happening, visualise what's happening, think about what's happening and feel what's happening. So that hand on the tummy is lifting with the breath in and lowering with the breath out. Breathe in through your nose, out through your mouth, through pursed lips. Imagine you're blowing through a straw. Do a couple more of these breaths. And then we want to put our hands around our waists and we want to create our 360-degree breath now. So what you should be feeling on your breath in is all the muscles around the abdominal wall expanding outwards, lifting and pushing your hands away, 360 degrees. So you want to feel that expansion equally from front to back and from side to side. So if you're not feeling anything, just cough, feel the muscles expand, and then use that to wake your muscles up, to let your brain know where the muscles are, and then you can just try and visualize and focus on those muscles now, lifting and pushing your fingers and thumbs away. If you're struggling with any particular area, so a lot of people struggle around the back, or they might have a difference from side to side, give it a poke, give it a prod, and really try and concentrate on the area that isn't inflating as much. Cough again if you need to. And then think about those muscles now, lifting and expanding equally the whole way around, so equal 360 degrees front to back and side to side. Okay, so once we've got our 360 degree breath, we're going to work on the brace. So your brace, it's not a clench, it's not a tense, and you're not pulling your belly button towards your spine. You're creating your 360 degree breath outwards, and then before you take your breath out, you're going to do an outward push like you're imagining that you're about to fart. So create that 360 degree breath and then an outward push. Imagine you're about to fart, and then try not to let those muscles completely relax as you're breathing out. Keep going, keep breathing in through your nose and out through your mouth, through pursed lips, like you're blowing through a straw. And we're trying to keep those muscles active throughout the breath in and out now. Just do a couple more breaths. Okay, so we've got our connection, we've got our 360 breath, and we've got our brace. So I want you to just take one leg up into the air and then slowly lower down, and then take the other leg up into the air and slowly lower down, and think about what's happening at your hip joint. So as you bring your leg up into the air, you want your hip to be externally rotating and abducting at the same time. So hip flexion is a coupled movement with abduction and external rotation. So as we're bringing the hip into flexion, we should be externally rotating and abducting it. And then as we take the foot down towards the floor, we want to be going out of that external rotation, abduction and flexion into a neutral position. And this movement wants to come from the hip, so we don't want the movement to cause the spine to extend, we don't want the pelvis to tilt forward, so we're just concentrating on creating this movement through the hip. do a couple more, and then we're gonna take both our legs up. So before you take both your legs up, we need to create the 360-degree breath, create the brace, and then slowly lift the legs up into the air, and then back down. And remember, as we're lifting, we're externally rotating and abducting. So when we're in this hip flexion position, the knees are going to be wider than the hips and the feet are going to be narrower than the knees. So keep going with that. So we're just lifting and lowering, keeping control of the pelvis and the lower back, and this movement is just coming from the hip. Just do a couple more. And then you're going to take your legs up into your 3-month supine position. So feet are going to be higher than the knees, knees over the hips, hips at 90 degrees, externally rotated and abducted. So your knees are wider than your hips and your feet are narrower than your knees. And then in this position, we're just going to do some hip rotations. So you're just going to take one of your legs out to the side, and then slightly extend the hip and then bring it back in and out to the side. So we're rotating the hips really slowly. Make sure that this movement's coming from the hip as well. Don't just be moving the foot around and the knee sort of rotating. So we actually want to move the hip. Start with small circles, and then if you feel like you can take your leg a bit wider, but only do that if you feel like you're controlling the movement so that the body isn't rolling all over the place. And then take it the opposite way. So we're reversing that movement. If you want, you can take the leg straight and do hip rotations with a straight leg one way, but you can keep the knee bent. You don't have to extend the knee. And then go the opposite way, keeping the lower back flat on the floor, neutral pelvis. And you just want this movement to come from the hip. Bring the knees in, give your hips a little rest, and then back into 3-month supine, and then you're going to do the opposite leg. So foot out to the knee out to the side, so we're rotating the hip. Again, make sure this movement comes from the hip. Nice and slow. We want this to be nice and smooth movements, not all cogwheel and jaggedy. So if you need to just take it into a smaller hip rotation, that's fine. You don't have to be so big with the movement. Go the opposite way. Keep focusing on your breath, creating that 360-degree breath. Straighten the leg if you want to. Do some straight leg hip rotations one way. Go the other way. Just a couple more. And then give your knees a little hug to your chest again. Just let your hips rest. And then grab hold of your feet into your 6-month supine, so feet are up towards the ceiling. I'm just going to hold this position and focus on your breath and feel that breath 360 degrees. Feel your lower back muscles pressing down into the floor. Couple more breaths. And bring the legs back into your 3-month supine. Fingers up to the ceiling. Lift your head slightly, and then you're just going to start to roll onto one side and then roll back and then onto the other side. As we roll, make sure you've got your Lego body, so your shoulders and pelvis move at the same time. We're not disconnecting. And when you land on your side, make sure that your shoulder is active. So you're landing stacked up on your shoulder, so we're not just letting that shoulder push forwards. And then roll back. Control the movement, don't let your body just flop to the side. And make sure you've got your straight spine, so we don't want a banana spine. So keep it nice and long. Keep breathing. Do a few more side to side. And then just roll up into your lower oblique sit. And we'll just do some lifts and lower. But just really slow and controlled. So opening the knees as we come up, and then closing the knees as we go down. Make sure your shoulder stays nice and active. Make sure your spine stays straight. Try and lift your bum as high off the floor as you can. So creating that external rotation in the hip and abduction. Just do a couple more. And then you're just going to roll onto your side, onto your back, up to the other side. And do the same. So lift and down. So just keep doing that. Trying to get the bum nice and high off the floor. Keep the spine straight, keep the shoulder active. Don't let the neck extend, keep the neck nice and long. Just do a couple more. And then come up into a high oblique sit, into an oblique sit. So I'm just gonna turn around so you can see me. And then from the oblique sit, we're just gonna lean into that, hinging at the hip, and lift up. Lift into your lift, back down, And then rotate round to the opposite side. Hinge forwards. Lift. Down. And just keep doing that now from side to side. Rotate one way. Hinge forwards. Lift up. Slow and controlled on the way down. Rotate round, and when we're in this tall sit position, make sure we're nice and tall, lengthening through the spine. And then when you do your hinge, when you fold in, just pause in that position before you come back up. And then come up. Remember not to land too heavily when you've lifted and lowered. You don't want to land heavily on the knees. Keep going, feel that movement in the hips. See if you can get a little bit more movement with each hinge. Just do a couple more on each side. And then what you're going to do next is you're going to lift up, take one leg forwards into your high kneel, and then control the leg back, slowly down, rotate round, lift into high kneel, and then slowly bring that leg round. So really try and control that high kneel to oblique sit. Keep going side to side. Just do a couple more each side. And then come up into your high kneel and make sure we've got our nice position. So, foot not too narrow, foot out to the side, pelvis level with the floor, neutral pelvis, neutral lower back. Make sure the knees tracking the second and third toe, and then we're just going to stand. Just in your own time, Making sure every high kneel to stand and every stand to high kneel is perfect, or as perfect as you can do. Don't rush the movement. Control that movement on the way down, especially. Keeping that pelvis level with the floor at all times. What we don't want is for the pelvis to either shoot to the side, knee to cave in, pelvis to rotate forwards. We want to keep square on, pelvis level with the floor. Slow it right down. When we take the leg back from the standing position, make sure we don't go too narrow, because we're just going to end up collapsing. Just do a couple more on this side. And then we're going to go down into our high kneel, and then we're just going to open the hips round to the opposite way, down and then round. So high kneel to high kneel. Again, just slowly go, don't rush the movement. Side to side. And then if you just come from the high kneel into the midpoint, we're just gonna rotate the hip. So back into, I'll kind of turn this way. So if we've got our feet staggered, open one hip and then back. Open the hip and back. So we're rotating around both hips really. So one foot staying planted, the back leg is rotating, so the foot's rotating round. So we're opening both hips. Try and keep neutral pelvis, neutral lower back. Keep nice and planted with that foot that isn't moving, big toe pressing into the floor. Woo. Try and keep the knee tracking the second and third toe on that foot. You should start to feel that supporting bum cheek starting to work. And then rotate round to the opposite side. So the other foot's going to be planted and we're going to open the opposite way. So rotating that back foot round, opening both hips. Remember to keep nice and long through the spine. Try and keep your neutral pelvis, neutral lower back. And remember your Lego body, so your body's rotating at the same time. So shoulders and pelvis moving at the same time. Couple more. And then rotate round into your high kneel on the opposite side. And we're going to high kneel to stand. So, not too narrow, foot to the side, pelvis level with the floor, neutral pelvis, neutral lower back, knee tracking second and third toe, and stand. And just in your own time, high kneel to stand, stand to high kneel, and just slow the movement down. Remember not to let that knee collapse in. Knees tracking that second and third toe. Don't let your pelvis rotate. Just do a few more. Last one. Then put the hands to the floor into your tripod. Bring that front leg back into your bear, down onto your knees, and we're going to go into low quadruped. So elbows in line with the ears, find your neutral pelvis, neutral lower back, so tilt your pelvis backwards and forwards until you feel like you've got that neutral position. Shoulders are going to be active, so you're externally rotating and depressing the shoulders, so the shoulder blades going down towards the back pocket on the same side. Push the floor away with your forearms. Try and lengthen the distance between your elbow and your shoulder. And then if you're like me and you're quite rounded through your upper back, we're going to aim to try and bring your upper back down towards the floor, mobilizing through the upper back, so we're creating extension through the upper back but without going into lumbar extension, so we keep the neutral pelvis, neutral lower back. If you're quite flat through your upper back, you're really going to have to work hard at pushing the floor away and not letting your thoracic spine go down towards the floor too much. So we're pushing the floor away and trying to separate the shoulder blades if you are quite flat through there. Keep the neck nice and neutral. And then just focus on your breathing, 360 degrees, and just hinge your hips backwards, nice and slow. Folding the hip. Go back as far as you can. And then just pause in that position. You can put your head on the floor and just create that 360 degree breath. Feel those lower back muscles expanding. Feel the abdominal wall expanding. Breathe in through your nose, out through your mouth. And then extend your hips forward, so we're coming out of that position, but try and control the lower back. Do not let your lower back extend, do not let your pelvis tilt forwards. And then come up onto your hands, so we're going into quadruped. And again, we're just going to do some hinging, so make sure you're nice and long through the spine, neutral pelvis, neutral lower back. Just going to hinge the hips backwards and forwards, and time. Control what's happening in the spine. So we're going backwards and forwards. And then what I want you to do next is when you come into your quadruped, take your feet to one side, and then we're just going to hinge backwards into our oblique sit. And then we're going to hinge forwards, back into our quadruped. Take the legs the opposite way. So one hip's going into external rotation, one's going into internal rotation, and hinge backwards into oblique sit. And forwards. Rotate the hips the opposite way. And keep focusing on your breath. 360-degree breathing, thinking about your brace. Keep rotating the hips from side to side each time you go back into your quadruped. And control the movement going on in the lower back and pelvis. Just do a couple more. And then come back into your quadruped. Neutral lower back, neutral pelvis. Push the floor away, and then you're just going to take one hip out to the side and extend backwards and bring it in. Take the other out, extend backwards and bring it in. And as we're doing it, the body wants to stay still, so you don't want to be shuffling from side to side. And the lower back, when we extend the hip, wants to stay neutral. Neutral pelvis, neutral lower back. We don't want to just take the lower back into extension. Keep pushing the floor away with the hands, keeping the shoulders active. Keep breathing. So side to side, one leg at a time. Just do a couple more. And then we're going to go into our bear position. So quadruped to bear. So find your neutral. Curl the feet under. Create your breath and your brace. Push the floor away. Lift the knees off the floor. Hinge your hips backwards. And then slowly lower. Come out of it and lower down into your quadruped. And then go again, so lift into bear and hinge. Hinge back out, slowly lower your knees to the floor. And again, lift and hinge. And just keep doing that. Create your 360 breath in your brace. Control your pelvis as you lift into your bear, so don't let your pelvis tilt forwards. Just do a couple more. And then we're going to hinge back and start to walk your hands backwards into your squat. And then just go down into a deep squat, as deep as you can go, and just feel that breath. So breathe into your back, breathe into your tummy. So a nice deep squat. Hold that. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Come up into a higher squat and then rotate one hip round. So the knees going to the floor, so just rotating around on the hip. Back into a squat and then round. So just do that from side to side. Just spend a few seconds in the position. When you get into it, put your knee on your top, your elbow on your top knee, and just give your hip a bit of a stretch. Just do a couple more. And then come into your squat and stand. And we're just going to, in your own time, just do some squats to stands, stands to squats. Thinking about what's happening in your pelvis. So we want the pelvis to stay completely neutral. Neutral lower back. Lengthening through the spine. When you get into your squat, just have a little pause at the bottom. Trying to lengthen through the upper back. Don't let your body round. And think about the weight distribution. So making sure that we are going straight down in the middle. If you feel like you're shifting to one side more than the other, just try and correct that shift. Just do a few more. Do 5 more. I've got 3 to go. Nice and control every time. Last one for me. And we're done. Hope you enjoyed that. I'll see you all soon.